So Bachapati, let's clear some confusion and concepts in transfusion reaction. So the most common transfusion reaction that is happening is febrile non-hemolytic transfusion reaction. The most serious is hemolytic transfusion reaction, but the most common and benign or self-limiting is a febrile non-hemolytic transfusion reaction. And that reaction is happening because why? There is fever, there is no hemolysis. So there is not going to be any intravascular hemolysis, but the fever is happening. And why fever? That means some kind of cytokines or interleukins are being involved, and that means somewhere the WBCs are being involved. So what is happening? Your donor WBCs, which are very, very docile, are being reacted or are being attacked by the recipient's antibodies or the recipient MHC molecules. So that is how febrile non-hemolytic transfusion reaction is happening. So the patient is going to have fever, or there may be mild hypotension also, but that is transient. Now next confusion is between TRALI and TACO. TRALI is transfusion related acute lung injury and TACO is transfusion associated circulatory overload. First to remember, TACO is non-immune. It is happening why? And it is delayed also. So it is happening after quite some time and repeated number of transfusions when the patient is going into some sort of a circulatory overload because of volume expansion. So this TACO is going to be affected by diuretics because the volume expansion has to be treated by diuretics. And the second thing is the pulmonary capillary wedge pressure is going to increase in that. Whereas in TRALI, what is happening? It is transfusion related acute lung injury. So there is some immune response involved. And what is that? It is opposite of FNHTR. So the donor antibodies attack the recipient's WBC, and these immune complexes or whatever the cytokines release, they form microthrombi in the pulmonary vasculature. The endothelium is damaged, and that is why the lungs are being affected. The FiO2 decreases, the patient goes into hypoxemia. And the pulmonary capillary wedge pressure and JVP are normal in TRALI. And how it is being treated? It is not affected by any use of the diuretics. So subtle points, and it is always acute. So whenever you get a history of the time period, acute is TRALI and delayed response is TACO, and FNHTR and also is, I think I have tried to make myself clear. So still you can put some doubts in the comment box and I would be happy to clear that.